Hi, welcome to the cervical muscle palpation tutorial. Today we're just focusing on the upper cervical muscles, and we've drawn them here on Jeffrey in order for you to visualize them better and to help us to demonstrate their attachments and their best place to be palpated. It's always best to start out with your patient in a comfortable seated position and make sure that you're in a comfortable position to the side of them and have them rest their head in your hand as you have a knife edge contact. Let's begin. We're going to start with the superior oblique. Its attachments are the C1 transverse process, and it goes up to the occiput. The best place to locate it is just behind the mastoid process, where the mastoid process meets the occipital shelf. Next, we'll look at the inferior oblique. It goes from the C1 transverse process to the C2 spinous. You can mark the C2 spinous with your thumb, and then with your middle finger mark the C1 transverse process. Split the difference, and in the laminar gutter you will palpate against the belly of the muscle the inferior oblique. Next, we'll look at the RCP major. It goes from the C2 spinous to the occiput. The best place to locate this muscle would be to go just from the C2 spinous up, just slightly superior and lateral, and palpate the muscle there. Now let's look at the RCP minor. Its attachments are the posterior tubercle of atlas, and it goes up to the occiput. We palpate this just underneath the occipital shelf in the superiorward direction. Now we'll look at the inner transversarii. It goes from the C1 transverse process to the C2 transverse process. The best place to locate it would be just to find the C1 transverse process and roll off of it into the inner transverse space. Next, the levator scapulae. This is just the C1 branch that we're demonstrating. It goes from the transverse process of C1 to the superior medial border of the scapula. The best place to locate it for atlas is also in the inner transverse space. It will palpate just posterior to the inner transversarii, and you can trace the muscle down. Now let's look at the splenius cervicis. Splenius cervicis attaches at C1 through C4 transverse processes and goes to the spinous processes of T3 through T7. The best place to locate the C1 branch is in the inner transverse space, just posterior to the levator scapula. And then to find the branch for C2, you simply go to the C2 transverse process and move inferior and posterior. The scalene goes from the C2 transverse process down to the first rib. To locate it, start at the transverse process of C2 and move anterior and inferior. Next, we're looking at the capitis muscles. The splenius capitis goes from the occiput to the spinous processes of C7 through T3. The semispinalis capitis goes from the occiput to the articulations of C4 through C6. To locate these muscles, which we palpate together, you simply trace around the mastoid process, follow along the occipital shelf, and find where these two muscles will overlap. It will feel like a soft tissue bump. This concludes our tutorial. I hope it's been helpful to you.